Today, we will be discussing about a low back pain. It's case 249. This patient is female, age 45, a homemaker. This patient had lumbar L5 and sacral 1 disc herniation surgery. But 2 weeks later, she re-herniated again. When she did the MRI, it only came out to be 2 millimeters. But she was experiencing severe amount of pain. She was recovering from the surgery and she herniated it again, so that aggravated the pain that she already had. She had 2 epidurals and gabapentin to relieve the pain, but they did not provide that much relief. 2 months ago, the pain was so severe that she had to be bedridden for 8 straight days, and then she had epidural. She was able to walk 2 days afterwards. The only position when lying down that eliminated pain was to be on her left side with pillows between the legs. Then she was able to sleep. Otherwise, no position was helpful. And of course, during the day, sitting, standing, it was just constant excruciating. And by the end of the day, the right sciatica was worsened. I gave her right side Yang Horary points in metal order, and the 5 points are LI1, UB66, gallbladder 41, small intestine 5, and stomach 36. They are horary points. Horary points are 5-element points on 5-element meridians. And these are also part of the transporting points on the hand and the leg. So I gave her these 5 spots just on the right hand side. There was no need for diagnosis because for horary, there is no diagnosis needed. You only have 2 choices. After the first session of acupuncture, there was a noticeably less pain, and that was immediate. Into the next day, it was still slightly better. She came in acupuncture twice a week. After each treatment, she noticed slight reduction of intensity, frequency, and duration of the pain. And the improvement was linear, meaning there was no fluctuating of symptoms up and down. And after each treatment, she noticed that additional accumulated benefit. By the 10th visit, which is at the end of 5 weeks, she was able to be mobile, do things throughout the house as a housewife, and she was able to walk a little bit longer, farther than 1 mile. In the big scheme of things, it's not a big change, but relative to the chronic low back pain she had prior and being bedridden for a long time and taking a long time for her to recover, this was tremendously helpful. And noting that it was a linear improvement without much up and down in her symptoms, this was to her amazing. What I noticed with low back patients with herniation, if they have 4 millimeters or higher, the result is not as good as those who have 3 millimeters or lower. In this case, she had 2 millimeter disc herniation, and of course, scar tissue, inflammation, and I'm sure there was a lot of spasm in her soft tissue of the muscles, and perhaps there were some minor issues going on with the tendons and ligaments too. In addition to needing the correct acupuncture points and having less structural issues, some patients are more reactive than other patients are. because of reactivity, they improve faster and the recovery is more stable. So for this patient, horary points of large intestine 1, UB66, gallbladder 41, small intestine 5, and stomach 36 were instrumental in her recovery. Yes, she is continuing to get acupuncture, but in retrospect, how much she's been improving every week, we could project forward to even more improvement to maximize that improvement. And when she's there, then she could get acupuncture every few weeks. It could be every 2 to 4 weeks, depending on how much is left over, so that we could maintain the improved state.